Multiple myeloma, also known as Kahler's disease, is a type of blood cancer that affects the plasma cells in your body. These cells are responsible for making antibodies to fight infections, but in multiple myeloma, they multiply the wrong way, causing too much protein to build up in your bones and blood, which can damage your organs. The overgrowth of plasma cells also crowds out regular blood cells in your bones and sends out chemicals that eat away at your bones, creating weak areas called lytic lesions. As the disease progresses, the plasma cells can spread from the bone marrow to other parts of the body, causing more organ damage. When it comes to conditions that can affect your plasma cells, multiple myeloma is just one of them. Other conditions include monoclonal gammopathy. This happens when your plasma cells produce too many copies of one antibody. Multiple myeloma is a type of this disorder. Another form, monoclonal gammopathy of undetermined significance, may increase your risk of developing multiple myeloma. Solitary plasmacytoma, similar to multiple myeloma, this condition involves a single abnormal growth of plasma cells, rather than multiple. It can occur inside or outside a bone and can also raise your risk of multiple myeloma. Light chain amyloidosis, this condition leads to abnormal plasma cells in your bone marrow, but there are fewer of them compared to multiple myeloma. Waldenström macroglobulinemia, this is a type of both monoclonal gammopathy and non-Hodgkin's lymphoma, which is a cancer of the lymph system. The cells of this cancer have features of both plasma cells and lymphoid tissue. Multiple myeloma is a type of cancer that affects the plasma cells in your bone marrow. Although the exact cause of multiple myeloma is not clear, there are some factors that may increase your risk of developing this condition. If you are over the age of 65, male, African American, have a family member with multiple myeloma, are overweight or obese, have been exposed to radiation, or have had contact with certain chemicals used in rubber manufacturing, woodworking, firefighting, or herbicides, you may be at a higher risk of developing multiple myeloma. As multiple myeloma progresses, you may start to experience a range of symptoms, including bone pain, which can be severe and may occur in the back or ribs. Weakness and fatigue, making it difficult to carry out daily activities. Weight loss and loss of appetite, leading to a decrease in energy levels. Upset stomach and constipation, causing discomfort and difficulty with digestion. Confusion and difficulty concentrating, affecting your mental clarity. Frequent infections, due to a weakened immune system. Severe thirst, as a result of dehydration. Weakness or numbness in your arms and legs, impacting your mobility and coordination. If you have a blood test for something else and it shows too much calcium in your blood, too few red blood cells, kidney problems, high total protein levels in your blood, but low levels of one called albumin. To confirm a diagnosis, you might have blood tests including a complete blood count, CBC, blood urea nitrogen, BUN, and creatinine to check how well your kidneys are working. Other blood and urine tests will check whether your body is making unusual proteins and, if so, what kinds and how much. Your doctor may also want to do a bone marrow biopsy to check the number of plasma cells in it. You might get imaging tests like X-rays, CT scan, MRI, or PET scan to see any bone damage caused by multiple myeloma. So, what are some of the symptoms of multiple myeloma? Well, here are a few things to look out for. Bone problems, which can lead to weaker bones and fractures. Blood problems, such as anemia, which can make you tired and pale, and also cause heart problems. You might also have too few platelets, which makes it harder for your blood to clot. Infections can also be a problem, as the weak antibodies produced by myeloma can crowd out healthy ones, making it harder for you to fight off infections. A lack of white blood cells can also weaken your immune system. And finally, kidney damage can occur, as myeloma can clog your kidneys and lead to kidney failure. In multiple myeloma cases, doctors assess the risk level based on genes in the tumors, which can be high, intermediate, or standard. If you don't have any symptoms, your doctor may decide to monitor you closely instead of starting treatment immediately. However, if you do have symptoms, your doctor will collaborate with you to develop a treatment plan that focuses on improving your quality of life, helping you feel better, and ensuring you receive adequate nutrition. For those with high-risk cases, joining a clinical trial for an existing or new treatment may be an option to consider, as ongoing research is seeking more effective drugs. The drugs used for multiple myeloma depend on your age and how serious your cancer is. Chemotherapy is often given in combinations to treat multiple myeloma. Some of the drugs used for this include bendamustine, Treanda; cyclophosphamide, Cytoxan; doxorubicin, Adriamycin; etoposide, VP16; liposomal doxorubicin, Doxil; melphalan, Alcaran, Ivamela; vincristine, Oncovin. Targeted therapies focus on specific proteins, genes, or tissues to stop cancer from growing. This includes monoclonal antibodies such as daratumumab, elotuzumab, and isatuximab. Proteasome inhibitors stop the process that breaks down extra proteins in cells. Drugs like bortezomib, carfilzomib, and ixazomib are used for this. Histone deacetylase, HDAC, inhibitors, like panobinostat, Faridac, and a nuclear export inhibitor called selinexor, Spovio, are also used to treat multiple myeloma. Immunomodulatory drugs strengthen your immune cells and help starve the myeloma cells in your bone marrow. Medications include lenalidomide, Revlimid; pomalidomide, Pomalyst; thalidomide, Thalamid. Immunotherapy uses your immune system to fight cancer cells. This includes chimeric antigen receptor, CR, T-cell therapy and interferon. Corticosteroids like dexamethasone or prednisone may also be prescribed to help other treatments work better. CR T-cell therapy is a treatment being tested for multiple myeloma. It stands for chimeric antigen receptor T-cell therapy. Doctors take your blood and remove the T-cells, which are important for your immune system. They use a virus to program these cells to find and kill cancer cells. Then, the cells are put back into your body to do their job. This treatment is still being studied to see how safe and effective it is. When dealing with multiple myeloma, your doctor may recommend a stem cell transplant. This procedure involves removing some of your own stem cells, freezing and storing them, or using stem cells from a donor. Afterward, you will undergo high-dose chemotherapy, sometimes combined with radiation. This treatment aims to destroy the plasma cells in your bone marrow, as well as healthy cells. Following the chemotherapy, the saved or donated stem cells will be reintroduced into your bloodstream through a catheter. These cells will then work to replace the destroyed bone marrow and produce healthy blood. It may take several weeks for your blood cells to fully replenish. While stem cell transplantation can help extend your life, it is not a cure for multiple myeloma and can lead to serious complications, such as an increased risk of infections. If your multiple myeloma is causing painful bone damage, your doctor may recommend the following treatments. Bisphosphonates. These drugs can help slow down bone breakdown and can be taken as pills or through a needle. Examples include pamidronate, Aridia, and zoledronic acid, Zometa. It's important to maintain good dental hygiene while taking these medications, as they can rarely cause damage to the jaw. Monoclonal antibodies, denosumab, Prolia, Zgeva, can help pause or stop the cells that are breaking down your bone. Radiation therapy. This involves directing a beam from a machine to a bone or affected body part to kill cancer cells, which can help ease pain and strengthen weakened bones. To feel better while undergoing treatment, it's important to take care of yourself. Eating a healthy diet is key. A dietitian can assist in choosing the right foods, especially if you're experiencing difficulty eating due to your treatment. If possible, try to stay active by exercising. This can help you feel better, increase your energy levels, and protect your bones. Make sure to get plenty of rest. It's okay to take naps or breaks throughout the day as needed. Take advantage of the good days. Use them to do activities you enjoy. Don't hesitate to ask for help. Support groups can be a great resource for both you and your family in managing this disease. When it comes to multiple myeloma, everyone's experience can be different. Some people may have few symptoms and live for years, while others may see their condition worsen quickly. There are tests that can help predict survival rates. The most common ones look at the levels of albumin and beta-2 microglobulin in your blood. A higher albumin level and a lower beta-2 microglobulin level usually mean a better chance of living longer. Other testing systems may involve lab or DNA tests on plasma cells. Understanding more about your multiple myeloma can help you and your doctor come up with the best treatment plan for you. If you want to learn more and find support for yourself and your family, you can visit the Multiple Myeloma Research Foundation's website.